it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side where the metal strip is. Ensure the proper...
is on.
Good day and welcome to our National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 20th day of October 2021. Thank you very much for joining us as we continue with the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. The pandemic is still with us, and because of that, we have to be vigilant and continue our prudent management of the COVID-19 virus among us. I want to invite first to the podium the Superintendent of Police, Mr. Cromwell Henry, who is a member of the National COVID-19 Task Force and the person on the National COVID-19 Task Force that deals specifically with the legislation and regulations and the enforcement of those. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. From the daily reports, we are seeing a gradual reduction in the number of new COVID-19 infections in the Federation. As our situation improves, we promise you that you will see a gradual easing of the restrictions, and we have done so. We ask, however, that you continue to be responsible and adhere to all the pharmaceutical and non-pharmaceutical guidance that is intended to reduce your risk of infection. Each iteration of the regulations reiterates the prevention protocols. This is an indication that we are not yet out of the woods. Social activities are still restricted and require permission from the Commissioner of Police. We have been granting permission for activities where applicants can show that they can safely host the event through the submission of a COVID-19 compliance plan along with their application. Other factors that we consider when processing these applications are the size of the venue, the number of persons attending the event, the location of the event, that is, whether indoor or outdoor, and outdoor events are preferable, the format or type of event, etc. Events that are approved are given a set of conditions and are monitored by the police and the compliance officers to ensure compliance with the conditions. Breaches of the conditions will attract enforcement action and will impact future permissions to the persons who violate the conditions. As you become more liberal with permissions for social activities, we ask that you do your part to ensure that your event is COVID-19 compliant, so that we can further expand the range and size of activities that we permit. We will reward your good behavior. Remember always to wear face masks when in public, maintain a physical distance of 6 feet from others, practice good hand hygiene and other sanitization behavior, avoid crowds and crowded places, and if possible, get vaccinated. Thank you.
Thank you, Superintendent Henry. I now invite the Acting Chief Medical Officer, the Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, to give us his presentation.
Thank you very much, Leslie. Sincere gratitude to them. While acting for the last 20 plus days and working with them, I was able to appreciate the magnitude of the work that they did. I want to start off on a positive note in that the Federation of St. Kitts and Nevis, we reached major for vaccines. They're still significantly behind us, and we are closing in on the United States that has 57% of the population vaccinated. I want to again make the appeal to the people of the Federation of St. Kitts and Nevis. Early on in this year, we were recognized as the nation with the lowest risk of COVID-19 in this part of the hemisphere, and we can again get that recognition once we continue to increase the vaccination coverage and to use the non-pharmaceuticals to protect us. When we look at the week in review, because it's important for us to know where we are coming from and where we are going. And so when we look at the data from Wednesday the 13th last week to Tuesday the 19th, we see that we had a total of 123 new cases. This was 49 cases less than the previous week. We had a total of 2 admissions and 6 discharges. Over this period, we recorded 682 recoveries. Okay, this is 370 more than the previous week. Thank God we had no deaths during this period, and the vaccination continues to climb in that during this period we had a total of 145 persons coming forward for their first shot and 626 persons completing their vaccination coverage. When we look at a comparison between the daily positives and the recoveries, we can see that the recoveries are far outnumbering the daily positives. The recoveries are in the, what color is that, brown? in the brown graph, and the daily positives in the blue. And you can see the daily recoveries significantly outnumber the positives. If we look at the graph that represents the current wave that we are going through, you can see that we have already peaked. Next slide. You can see that we have already peaked and we are on the other side of the graph now. So when you look at the graph, you see those little spikes. That was when we were going through the wave and we were having figures in the 30s, 1 or 2 in the 40s. But over the last week, we have been seeing the numbers decrease significantly. And so you can see that we are on the downward side of the curve and in a state of significant recovery. So the situation report as of yesterday, Tuesday, the 19th of October, we had a total of 2,589 confirmed cases, 409 in Nevis, 2,180 in St. Kitts. We had a total of 417 active cases, 73 in Nevis, 344 in St. Kitts, and we recorded a total of 2,151 recoveries. We had a total of 6 hospitalizations between the 2 islands, 2 in Nevis and 4 in St. Kitts. And the death remained the same, 21. While I was here getting ready for this presentation, the figures for today came in, and you will see them on the situation report that will be released a little later. And for the last 24 hours, we had a total of 2 new cases. We had over 30 recoveries, bringing our active cases down to 388 and 0 deaths. And so this is a sign that we are turning the curve and we are headed in the right direction. Again, we want to analyze the deaths that we have had. We said we had a total of 21 deaths, 18 in Nevis, 18 in St. Kitts, 3 in Nevis. And again, I want to state here that the majority of the persons who are dying are people who are unvaccinated, and we need to make sure that we protect ourselves with the best tool that we have available to fight this virus. Again, looking at the age group, there is no age group that is immune, and so even if you're in your 20s, 30s, or 40s, and you think that you're big and strong like an ox, and you're exercising and you're taking your vitamins, etc., you can still get COVID-19, and you can still die from COVID-19, especially if you have comorbid conditions. We see that we had about 13 deaths over the age of 60. And I will tell you that one of the deaths was an elderly person in a nursing home. And this drives home the point that if you are an essential worker, especially if you're working in a nursing home, if you're working in the hospital, you have a moral responsibility to go forward and get vaccinated. There's actually no reason why we, for example, should have a nursing home that is closed to visitors, and so a vaccinated relative cannot go and visit their relatives in the nursing home, but you are going to have somebody who is working there who is not vaccinated going in to take care of those persons. And so I want to make an appeal again to all of the healthcare workers to come forward and be vaccinated. When we compare our mortality rate per 100,000 population to the rest of the OECS, you can see that our mortality rate is lower than those persons. And so the majority of our patients who were infected, we were able to manage them outside of hospital, and the death rate among them is pretty low. Again, when we analyze the number of positive cases that we were seeing, the majority of them are among the unvaccinated. Yes, if you are vaccinated, you can have what's called a breakthrough infection, but it's important first to emphasize the point that when you're vaccinated, you have significant protection against becoming infected, but some persons may get what's called a breakthrough infection. When persons get breakthrough infections, these infections tend to be mild, self-limiting, or they might be asymptomatic, and so the vaccine still gives you the best protection. If we look at the vaccination tile, we will see, again, as I mentioned before, that the percentage of persons, my friend, could you change it? Yeah, we can see again the percentage of persons who, the percentage of adults who are fully vaccinated is 70.3%, and those with one dose, 76.2%. I believe yesterday, the tile was reflecting 77. We made some adjustment because there was some error in calculation. So the actual figure from yesterday, the total adults with one dose is 76.2, and we have over 70% of adults fully vaccinated. Our teenagers between the ages of 12 to 17, they continue to come forward, and we now have 6.8% of that population who are fully vaccinated, and 10.9% who have at least one shot. We said before that we need to get to 80% of adults vaccinated so that we can see a lessening of the restrictions, and 80% of the adult population is actually 26,430. Who's changing the slides? Okay, we now have 25,571 adults who are vaccinated, which means that we need to get another 859 vaccinated for us to get to the 80% threshold. This means that if the vaccinated persons just form themselves into groups of 30, all they need to do is to bring one person in tomorrow, and we'll be at 80%. So this shows you how achievable this goal is, and I think that we need to strive to get to that goal. And what is good is that every time persons come forward for their first shot, we see that they're showing up for their second shot. And so the fully vaccinated percentage is closely following those persons with one shot. And this is significant. In some countries, persons come forward for their first shot and they're lost to follow-up. I'm happy that the people of the Federation of St. Kitts and Nevis have been doing the correct thing and coming forward to be vaccinated. We also need to get at least 80% of our school children vaccinated. There is nothing that could replace in-class learning as compared to virtual learning. And 80% of the teenagers, that will come to 3,840. We are on our way there. We've just started. We have a total of 524 who have received at least one shot. We need a further 3,316. And I again want to make an appeal to all of the parents and guardians to make sure that you bring your children into the clinic. You don't have to wait until you have the scheduled appointment with the schools. You can come at your convenience. The clinics are open 7 days a week. Just check for the opening hours and bring your child in to be vaccinated. The Ministry of Health is working in collaboration with the Ministry of Education, and we have been having regular education sessions with a number of schools. I participated in a number of these education sessions, the PTA, or parent-teachers meeting that the Ministry of Health and Education have organized, and they were very instructive. There are parents who had genuine concerns, and I was happy that we were able to address these. I've said before that I believe that vaccination is a journey. It's not everyone who's going to get it right away, and there are a number of persons who are out there who haven't been vaccinated, not because they are anti-vaxxers, but they have questions that they need to be answered. For example, something that I took for granted, there's a parent who asked me, what about the allergy? If my child gets an allergy to the vaccine, does that mean that the child is going to die? And I had to explain to them, no. That is one of the reasons why we are giving the vaccine in a health facility, because if they start to show signs of an allergy, where they're getting any itching, swelling of the lips, etc., we can start the treatment with antihistamines and steroids, etc., to abort the allergic reaction. The same way if you were allergic to crab and you ate crab inadvertently, or if you were allergic to a penicillin and you got a penicillin injection, there are medications that can be given to abort the reaction. So it doesn't mean that if your child had an allergic reaction to the vaccination, that it's a death sentence. And that's one of the reasons why we will observe you in a health center so that you can get the correct treatment. And so the education session started last week, and we are continuing with the education sessions. I believe that we should complete most of the schools this week, and the schools will be given appointments to go to the clinic so that the teenagers can be vaccinated. We know that there are some parents who are busy and they may not be able to come with their children, and so the education department would be sending a form home with the child so that if you cannot make it, you can sign that form so that the teacher can take the child in to be vaccinated. I encourage the schools to engage in a competition that's called the Race to 80 School Competition, because I believe that the school that reaches 80% of the teenagers being vaccinated should be recognized. And so there's a competition that is on. I know when I was speaking to the Charles E. Mill School, they said that they were the champion school. I told them that I went to Bastia High School. I thought Bastia High School was the champion school. Washington Archibald has told me that they are the champion school. So I believe each school is a champion in its own right, but you will show us who is the true champion by making sure that your school children come out to be vaccinated, and the teachers also, so we can see which school wins the race to 80%. We speak about the all of society approach all the time, and I want to make an appeal to the business sector, because COVID-19 vaccine rollout is our greatest chance at ending this pandemic and enabling the economy to recover. And there are certain things that the business sector can do, and I just want to throw out some suggestions here. For example, the businesses, they can make masks affordable or free with your company's logo, and you can also be advertising vaccination at the same time. So I can go into TDC or Rams or Hosfords, and instead of being turned back because I don't have a mask, you could be offering the mask there with your logo and also promoting the vaccination. So when I'm walking out, even though I can't see it, I'll be spreading the message to everyone. You can offer discounts and giveaways to persons who show a vaccinated card. The hotels that were complaining about the downturn in the economy and the fact that there weren't guests that were coming in during the periods of lockdown, etc., they can offer reduced rates to our locals who are vaccinated. We can have back-to-school discounts to all of the children from schools that have a high vaccination rate. And so we're not saying that any child will suffer because they're not vaccinated. But if, for example, the Charles E. Middle School is ahead with vaccination, you can be offering discounts to every single child from that school, and that will encourage more persons to come around. When I was in the United States the other day, I was surprised to see the amount of billboards, etc., I saw around promoting vaccinations, etc. And you can advertise your business and at the same time advertise and promote vaccination and social distancing, etc. You can have subliminal messages coming over your intercom when you're playing your music, and you will be surprised how these messages work, and they would encourage persons to come forward. You can also offer incentives to your staff. I know that there are some businesses that have been doing that, but we need to see more of that, because I want to say here that the greatest economic stimulus is to get the greatest number of people vaccinated as quickly as possible. The Ministry of Health, effective Wednesday the 12th, that is last week, we started with a new testing policy in the hotels, where we turned over the testing responsibility to the hotels themselves. And so travelers who go to the COVID-19 approved hotels, the samples are taken there by a trained medical professional. The results are sent off by the hotels to the labs. The results are received by the hotels. All the positive results will be communicated to the CMO's office, but the hotels will communicate the negative results to the guests and release them from quarantine. And that has been working quite quite well. I'm pretty certain Mr. Samuel might mention how that is going, okay, but it's been good. There are some persons who ask, well, why the 24-hour quarantine? Why not no quarantine? Well, first of all, we have to be thankful for small mercies, because we started with the country being locked down and borders closed in the fight. And then the borders opened up, and then we had a 14-day quarantine, then a 9, I think a 7 and a 4. Now we are at 24. And the reason why we moved to 24, first of all, we looked at the data for the previous month, which reflected what was happening over a month or two prior, and showed that of the 844 positive cases, only 11 or 1.3% came from inbound passengers, and 833 or 98.7% came from the community. And this showed us that the inbound passenger who was vaccinated and who had a negative PCR test within 72 hours of travel, they posed a lower risk than other persons just walking around. And so that is why we reduced it to 24 hours. We, however, added the test to relief as an extra protection to us as we gradually move towards opening. And so what will be the next logical step? I believe that the next logical step will be, instead of having the PCR test to be released from quarantine, it will be the antigen test, and then after that, it might be no quarantine for the fully vaccinated person. But the timing of this depends on you. You have all the controls in your hand, because the more persons who come forward and get vaccinated, and the greater threshold of immunity and protection we have, is the more risk we can absorb. And so if you want your relatives to be able to come off the plane, and for you to be able to greet them again as they come off the plane, you need to make sure that you get vaccinated. So the control is all in your hands. I was happy while I was sitting here that I got a WhatsApp message from our Minister of Health, the Honorable Akila Byron, to say that the recommendations that the Ministry of Health and the task force put forward re our testing was approved in Cabinet. I said over the last 2 meetings here what I've been saying all along, that we were looking at the science and the information behind the antigen testing, and that once these tests became sufficiently sensitive and specific, we will think about using them. And the World Health Organization recommends the use of the antigen tests in 4 scenarios in terms of case finding, outbreak investigation, and monitoring trends and contact tracing. And the Cabinet has approved the use of the antigen test in 3 of these 4 scenarios for case finding, outbreak investigations, and monitoring trends. And so this means going forward, if, for example, there's an outbreak in a school, instead of us having to test the entire class or the entire school with a PCR test and will take days to get the results back, we can do testing with the rapid antigen test, get the results back almost within 30 minutes to an hour, and determine how we move forward. If there's an outbreak in the prison or in the cabin home, we can get results at a very quick way. We will always still have the PCR test to confirm if we have any positive cases, and the PCR test will continue to be used for the contact tracing. The only rapid antigen tests that we'll be using are those that are approved by the World Health Organization and the FDA. And we say FDA because there are a number of our guests who come from the United States and have to go back to the United States. And so there's actually no reason why a passenger leaving here, going to the US, where they will accept an antigen test, and we will be forcing them to do a PCR test. And so the rapid antigen test is also now being offered to the outgoing passengers. And all of the private labs, they are ready to roll so that you can go there this afternoon or tomorrow and have your rapid antigen test done if it is so indicated. The samples will only be collected from a trained professional. In other words, you can't decide that you're going to bring in an antigen kit and do it yourself, because you can take the sample from your heel and it will come back negative. And so we need to make sure that the sample is being taken from where it is supposed to be taken, and the test will be run in our certified labs for it to be recognized. I am just going to mention the field hospital briefly, and Mr. Abdir Samuel, I believe that he will expound upon this. But some persons were asking, why did we need the field hospital? Did we get the field hospital because we were having a massive outbreak? Well, you can see from our data that the cases are decreasing, the hospitalization rate is decreasing, and so this was not so at all. A field hospital is a temporary hospital where emergency health services are provided temporarily to victims injured in epidemics, wars, natural disasters, hurricanes, earthquakes, and flood. And so if tomorrow there is an earthquake and we need the field hospital down in Sandy Point, we'll take it down there. But for now, the only significant crisis we have is the COVID-19 crisis, and that is why the field hospital initially, in the first instance, will be placed at the Joseph M. France Hospital. Some persons ask, are we having Carnival? This is still being discussed, but I can tell you that from a health perspective, there is no reason why we cannot have Carnival, and I'm pretty certain that at the end of the day, you will see Mr. Abdir Samuel and Kwame and a few others, Leswai, maybe at a Calypso show, a Queen show, etc., because we believe that if last year we had some degree of Carnival with no one vaccinated, with our high vaccination rate, we should be able to have a number of events, specifically events that are in a close setting with vaccinated persons safely, okay, because mass gathering is described as persons coming together but not overwhelming the healthcare system. And we believe that we can have a significant number of persons who are vaccinated coming together, and because there will be a lower risk of viral transmission, they will not threaten our healthcare system. So I'll not be surprised if at the end of the day we have a Queen show, a Calypso show, or other events safely. Now, what do we have in the education corner? There are a couple of things I want to address. There's some persons ask, if you've had COVID-19 before, does your natural immunity work better than the vaccine? In other words, if you got immunity from the infection, does that work better than the vaccine? And can that be replaced? Instead of you being vaccinated, once you recover, we can count you as part of our immunization threshold. Well, the data is clear. Natural immunity is not better. In other words, getting immunity from becoming infected is not better than getting immunity through vaccination. The COVID-19 vaccines create more effective and longer-lasting immunity than immunity from infections. And more than 1/3 of COVID-19 infections result in zero protective antibodies. And it's important for you to remember this fact. In other words, about 33% of persons who get COVID-19, they may not have any protective antibodies after they recover. Okay? Also, natural immunity fades faster than immunity after the vaccine. And real-world studies, the next slide, also indicate natural immunity short life. For example, 65% of persons who get infected with COVID-19, they actually develop what's called a low baseline antibodies. And these antibodies are depleted quickly in that within 60 days, they may have no antibody response at all. It also shows that natural immunity alone is less than half as effective as natural immunity plus vaccination. In other words, if you recovered from COVID-19, you would need to be vaccinated to boost your immune system. Studies have also shown that after infection, unvaccinated persons are 2.34 times likelier to get COVID-19 again compared to the fully vaccinated. And don't forget, when the fully vaccinated do get infected, these are called breakthrough infections, and they tend to be mild. And so what this basically is telling us is, number one, even if you recovered from COVID-19, you can get COVID-19 again, and you are much more likely to get it than somebody who is vaccinated. It also tells us that you can recover from COVID-19, and you may not have any protective antibodies at all, so that you can get it soon after you recover if you were exposed to someone again, because 33% of persons have no detectable antibodies after they recover. And another 2/3 or 65% of persons, they have such a low baseline antibody that they decrease after 60 days. And this, therefore, the lesson to be learned from this is that you would need to be vaccinated after you have been, after you have recovered from COVID-19. So the question that is asked, how soon after COVID-19 infection can I get vaccinated? How soon is too soon to get COVID-19 vaccination? No time is too soon. Therefore, what we're saying here, as soon as you are declared recovered, you can be vaccinated. And I want to make sure that everybody understands this, including the general public, including the persons who work in the health centers, etc. No time is too soon. And so once you have been deemed recovered, you can go in the next day and get vaccinated. You do not have to wait 60 days. Where this 60-day talk came about was because we know that about 2/3 of persons will have some antibodies to protect them probably up to 60 days. In countries where vaccines are scarce, you will put these people at the back of the line and continue to vaccinate persons who have no protection at all. But here in St. Kitts and Nevis, we have more than enough vaccines to vaccinate all who need to be vaccinated, and therefore there is no reason for any delay at all. And so once you have been deemed recovered, you can go into the clinic and get vaccinated. So even if you were told something different yesterday or the day before, you know what the information is now, you can go in tomorrow to be vaccinated. The other thing I want to speak about is boosters, a booster shot. So what is a COVID-19 booster shot? A COVID-19 booster shot is an additional dose of vaccine given after the protection provided by the original shot has begun to decrease over time. And boosters are designed to help people maintain their level of immunity longer. Okay, so a booster shot, as it suggests, it boosts your immune system. And so persons who would have been vaccinated more than 6 months ago, if your immunity is waning, you can get a shot to boost your immune system. This is separate to what's called a third dose of coronavirus vaccine. And it's important for us to understand the difference. A third dose of the vaccine is actually identical to the first 2 doses, and it can help to protect people with weakened immune system who did not have a strong enough response to the first 2 doses when they were given, okay? And such persons can have that third dose as early as 28 days after the second dose. And basically we're saying that there are some persons who would have received their 2 doses, but they would not have had the response, developed the level of antibodies that a normal person would have had. And so they would need a third dose to get the same effect that 2 doses would have caused in a normal person. So the question that is asked, who gets a booster shot? The COVID-19 booster shots are available for the following recipients who completed their initial series at least 6 months ago. For persons who are 65 years and older, for persons who are 18 and live in a long-term care facility, for persons who are 18 and over, who have underlying medical conditions like diabetes, hypertension, kidney disease, etc., for persons who are 18 and older and working in a high-risk setting, for example, if you're working in a hospital, a nursing home, a prison, and for persons who are 18 years and older and who live in a high-risk setting, for example, if you're in a prison, a nursing home, or even in a hospital. Now, as it relates to the third dose now, who can get a third dose? Based on the CDC recommendation, third dose vaccine doses are available now for people who are considered moderately to severe immunosuppressed. In other words, their immune system is so weakened that they cannot mount a proper response, and so they would need 3 doses to get the same effect that 2 doses will cause in a normal person. And just briefly, persons, for example, who are receiving cancer treatment, because that would suppress your immune system, persons who had organ transplant and were taking medication to suppress the immune system, persons also who had stem cell transplant where they were receiving immunosuppressions, people with a rare disease, Dye-George syndrome or Wiskov-Aldrich syndrome, which are congenital immune deficiency syndromes, persons with HIV who are not being properly treated, and persons who are taking high-dose steroids or other medications that can affect the immune system. These persons would need to have a third dose. The other question that is asked is, would a third dose COVID shot have to be the same brand of vaccine that I got originally? And ideally, the answer is yes. In other words, if you had somebody who was immunocompromised and you gave them their 2 first shots of Pfizer and they did not have a proper immune response, ideally, they should get the same vaccine for their third dose. Now, as it relates to the booster, however, next slide, the question is asked, can we mix and match by getting different brands of vaccines for the boosters? For example, should a person who initially got Pfizer for their first doses get AstraZeneca for their booster shot, or vice versa? If you had AstraZeneca for your first shots, can you get Pfizer as a booster? And the answer is yes, it is actually possible for you to mix and match with the boosters. And so persons who got their 2 doses of AstraZeneca, they can have a Pfizer shot to boost their immune system. Persons who got their 2 Pfizer shots, they could have a 3rd Pfizer shot. And what the Ministry of Health is going to be moving forward in terms of doing, we said that we had more than enough vaccines available. And while the vaccine uptake continues, though slowly, we are not going to waste any vaccines. And so what we are saying now is that if you are in one of the categories where you qualify for a booster shot, you can actually come in and get a booster shot, because we are not going to be taking vaccines out of the cold storage device, have them in a regular refrigerator for 31 days, and discard them because we didn't have enough persons who came forward to be vaccinated, when there are other persons who would need a booster shot to boost the immune system, to prevent them from becoming strain on our healthcare system, okay? And so it's important for us to understand that. Now, I just thought that I would end by explaining to you what might happen if you go to the hospital, because we know what you can do to keep yourself out of the hospital. You can use non-pharmaceuticals, but most importantly, if you're 12 years and older, getting vaccinated will give you the best protection against severe disease, which means that it can keep you out of the hospital and it can keep you out of the graveyard. But if you happen to have been infected and you go to the hospital, you will go to the respiratory side in these institutions, and you will be assessed. And the persons who would be considered for admission are persons who have comorbidities. In other words, if you had like diabetes, uncontrolled hypertension, kidney disease, conditions where if you were infected, it can push you over the edge, because these will be considered high risk. Everyone, if you have any respiratory symptoms, you will have a chest x-ray, and if the x-ray shows that you have more than 30% damage, then you will be admitted. And here is where now all of the injection started, and there was a gentleman who recovered and wrote a very nice article on Facebook, and he said while he was in hospital, he considered why he didn't go forward and take the 1 shot when he received almost 60 injections while he was in the hospital. And so you will be given IV dexamethasone. You will have to be anticoagulated with Clexane, because we know COVID-19 can give you a significant increase in clots. You'll be given several broad-spectrum antibiotics. You'll be given oxygen supplementation to maintain your oxygen saturation at a reasonable level. If you develop respiratory failure, you will have to be placed on the ventilator. And it's important for you to know that around the world, most persons who go on the ventilator, they tend not to come off. You will also be given some vitamin cocktails and medications to protect your stomach. But the most important thing is, if you accept the vaccine, then you can protect yourself from going to the hospital. So all you have to do is to come forward and get 1 shot of the Pfizer today, another shot in 3 weeks, or 1 shot of the AstraZeneca if you're 18 years and older, and another within 4 to 12 weeks, and you can avoid the 150 or 200 shots that you might have to take if you go to the hospital and you have to spend an extended period of time. And we can't overemphasize the non-pharmaceuticals, which you know so well. I thank you for listening.
And I thank you for sharing, Acting Chief Medical Officer, Dr. Cameron Wilkinson. I would like to invite now to the podium Mr. Abdias Samuel, the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMO, to give us his presentation.
Pleasant good afternoon, everyone, and thank you, Mr. Williams. And Dr. Wilkinson, I'm glad I took my 2 as opposed to the 117. Very much so. That's frightening. All right. So today for this briefing, I'm going to bring you some updates regarding certain matters that were discussed this week within the National COVID-19 Task Force and at the cabinet level. I want to share with you an article. Next slide, please. That came out of Meppen, Jamaica, where Meppen gets 40-bed field hospitals. And if in one of the slides it says the donation forms part of the U.S. Southern Command's ongoing assistance to nations in the Caribbean, Central America, and South America, funded by the Command's Humanitarian Assistance Project. So therefore, ladies and gentlemen, those listening, the field hospital, 40-bed field hospital, is not as a result of a major outbreak that we have in St. Kitts and Nevis, and the corona is out of control and our health system is overwhelmed. It's a preparedness asset so that we can respond appropriately if it becomes necessary. So I hope that that can clear the air and some of these misconceptions that are out there regarding the field hospital. So I hope that this can clear the air. This is an initiative by U.S. Southern Command, not only for St. Kitts and Nevis, not only for the Caribbean, but for Central and South America. Effective Wednesday, 20th October 2021, the Federal Cabinet of St. Kitts and Nevis approved the recommendation of the National COVID-19 Task Force to have South Africa and India removed from the travel advisory. So, however, please note that Brazil remains on a travel advisory for St. Kitts and Nevis. So therefore, persons traveling from South Africa and India will no longer have any challenges coming to entering St. Kitts and Nevis. So please note this information and update. Again, I also want to inform you, as was stated by Dr. Wilkinson, today we received information just a while ago that outbound passengers, again, these are passengers leaving the Federation of St. Kitts and Nevis, can now do so, bearing in mind the requirement for the country of their destination. So if your destination does not require a test, that means that you don't have to test. If your destination requires a rapid test or antigen test, then you are allowed to leave the country with such testing results. So I think this is good news. And my understanding is that Ms. Brown, the CEO of the Tourism Authority, she will be notifying the various hotels in due course officially. On the 19th of October, the National COVID-19 Task Force would have met with the St. Kitts Taxi Association, represented by Mr. Tyrone Richardson, the Lyamiga Taxi Association, represented by David Flames Brandy, and the St. Kitts Taxi Cooperative, represented by Mr. Sylvester Hodge. Equally so, in this meeting, we would have had the presence of Ms. Avanis Thompson, who would have represented Cantos de l'Île Walwyn, and Mr. Jonathan Bass, who represented Scenic Railway. And also, we would have had representation from Tourism Authority. Present in this meeting was the Honorable Attorney General, Mr. Vincent Byron Jr., and the Honorable Wendy Phipps, the chair and co-chair of the Mitigation Council. Superintendent Henry was also present. Amongst the many topics that were discussed is the hiking tours, opening of many additional tours, such as ATV tours, hiking tours, open safaris, and tours on Nevis. And what we want to do, based on the number of calls that are forecasted for St. Kitts and Nevis, meaning cruise calls for St. Kitts and Nevis, this will require that we have more tours open, and this is something that we are pursuing vigorously so that we could have a number of these tours open as soon as possible within a safe environment. And I want to take this opportunity, based on the numbers of port calls that are being projected for the month of November and December, in particular, as was stated by the Minister of Tourism, that I think he said that the 16th or the 17th of November, we may have 3 cruise ships in port. That means you're looking at probably anywhere between 3,000 to 5,000 persons coming to the Federation of St. Kitts and Nevis. So in this regard, it's going to require that we need to have our taxi operators, tour operators, and those service providers within the tourism sector ready to provide services, as we need to remain a very competitive destination. So what will this require? Again, it will require those who are not vaccinated, please, you have the time between now and then to go and get vaccinated. You can go and get your Pfizer shot tomorrow, and within 21 days, correct, Dr. Wilkinson? Yes. You can get your second shot, and then within 14 days after, you will be considered fully vaccinated. So we want you to get a piece of the pie. The pie is for everyone, and that discussion that we had with these stakeholders was very productive, and I want to commend them for their contribution to ensuring that we remain a competitive tourism destination. I also want to encourage persons within the sector to attend the travel-approved SEAL training hosted by the Ministry of Tourism in collaboration with the Ministry of Health. Go and get your travel-approved SEAL training. I am speaking to the hair braiders and others who we know have been suffering significantly, and those who provide certain services that sometimes we look at those as insignificant, but they are significant. We want everyone to come back to the sector and be able to make a living again. And lastly, I want a person to prepare yourself to apply your trade in a safe and secure manner. For example, again, the hair braiders. I've been in contact with a number of persons who provide these services, and my heart goes out to them because I know it's hard and challenging. But the same way that we go to a barber shop and get our hair cut, I think we need to make the necessary provisions available to have these persons perform their trade, now that we are going to have a quote-unquote revival of our cruise tourism in St. Kitts and Nevis. So I must say to you that also the National COVID-19 Task Force would have met on the 19th as well, and we would have had some presentation being made by Ms. Raquel Brown to the task force regarding a number of tours for consideration, and a number of these tours were given the nod of approval for final approval by the cabinet. We were satisfied that what was presented was satisfactory and would have met the criteria to ensure we maintain the integrity of the bubble. That's basically a safety corridor for the guests. And these tours will be taken to cabinet to get the necessary final approvals and then communicated to the tour operators. So we do look forward to having an expansion in the number of tours being offered in St. Kitts and Nevis. A number of tours which require inspection, those are still under consideration, and under consideration pending the completion of the inspections to make sure that what the proposal says is in place, and there is no security concern, and there is no concern from the medical perspective and the overall compliance perspective for these particular tours. We are hopeful that by the end of this week, we will have a number of these tours approved. The National COVID-19 Task Force will be meeting with the St. Kitts and Nevis National Committee, Carnival Committee, to finalize the proposal submitted. This proposal, I must say to you, has received favorable consideration based on the recommendation placed forward by the committee. We think that, as Dr. Wilkinson said, that these activities can happen and happen in a very safe manner around this time. Yesterday, also, the National COVID-19 Task Force would have spent considerable amount of time perusing the protocol submitted by the Ministry of Entertainment. We will now advise the Ministry of Entertainment on a number of recommendations that came out of our deliberations, and then this document will be presented to Cabinet for final approval. Once this is done, I think this will help the Carnival Committee to be able to carry out or expand the number of activities they wish to carry out. For example, how do we address situations of having the unvaccinated and the vaccinated? Do we consider a fully vaccinated event? Do we consider an event where you have persons who are fully vaccinated and someone who is not vaccinated present a PCR test, approximately maybe 48 hours or 24 hours before the event? These are some of the considerations that are being reviewed so that we can move on and reopen the entertainment sector so that the persons applying their trade in this area can begin to see some economic recovery as well. Ladies and gentlemen, in our CDM strategy, meaning Comprehensive Disaster Management Strategy, we have to advise you of anything that we see as any potential risk or threat to the Federation of St. Kitts and Nevis. It is not always going to be a natural event or a man-made event. It will also be technological hazards and many other hazards. For the past few briefings, I have been bringing to your attention the fact that there are challenges with the food supply chain or the supply chain in general. We know that countries such as China are having challenges in the distribution process. For example, I want to share with you this article that was shared with me that says that Antigua and Barbuda loses major shipping service as Crowley exits the region. These are some of the things that would basically hinder the progress in our food supply channels in the Caribbean region. So I want to again appeal to persons to manage whatever supplies they have. Please pay attention to this situation, because just imagine that we don't have rice, we don't have the basic essentials. These things bring a level of social instability or unrest, and we don't want that. That in itself is a crisis. So we're trying our best to see how we could mitigate the impact of events like these. No, we don't want to be alarmists, and we don't want to create any panic. What we want is to have a resilient society that is prepared to respond to any type of eventuality that may affect our way of living. All right, so I am appealing to everyone to monitor these situations and ensure that if this is affected, you have enough supplies to last us for a while. So please pay attention to these global situations, as globalization is just next door. The Atlantic, when it comes to the weather, the Atlantic is rather calm at this moment. We don't see, for the next 48 hours, we don't see no threatening activities to the Federation of St. Kitts and Nevis, nor the region. With that said, again, I want to appeal to persons in the tourism sector in particular to become innovative and creative, come up with ideas or understanding based on what was shared with us from the agents of some of these ships, that we may have in November about 32, 36 calls, and in December we may have more. So we also need to make sure that we bring down some of the barriers. So when we hit that 80% mark, we need to review the regulations. which, will end by tomorrow morning. We should have new regulations by tomorrow morning. And we have to make sure that that fencing around Port Zante should come down, and we start to look at how best we can lessen the restrictions that we have for us here as a result of the COVID-19 pandemic. So again, each one, teach one, each one, hold one, take them to get vaccinated. Let's meet that 80% threshold, and then let's see how we move the country in a different direction from there on. We see right now that in the UK, according to the BBC, there's a rising cases, and we see in other countries as well that there is a rise in cases, there's a surge in cases. And I think we are doing well right now to control our cases. Make sure if you see something wrong, please contact us, let us know, or please talk to your neighbor, talk to your friend, and let them know that they are contravening the regulations and the protocols. Again, each one, hold one, take one, get them vaccinated. Let's meet that 80% threshold. Thank you.
Thank you very much, Mr. Samuel, for your presentation. So much depends on China. So much is made there, That brings us to our question and answer segment. And the first question goes to Dr. Wilkinson. A past chief medical officer has said that the actual population of St. Kitts and Nevis is closer to 50,000, and not the lower figure being used on the vaccination dashboard from the last census. The person claimed that based on his vaccination coverage, that based on this, our vaccination coverage is actually much lower than we are indicating. How do you respond to this accusation, Dr. Wilkinson?
We have said all along that our primary focus is the safety and security of all of our citizens and residents. We have said all along also that we want to get all who should be vaccinated so we can have a significantly high threshold of immunity so that we can protect everyone, including those who can't protect themselves. And I'm speaking specifically now about the very young and the very old. And so, if there is anyone out there, including any past CMO, who has an interest in the pediatric population of our country, who has an interest in the geriatric population of our country, they should be joining forces with us to make sure that we get everyone vaccinated. And so if there's anyone out there who knows of an extra 5,000, 10,000 or 20,000 persons that we are missing, it means that you have an even more urgent call to come to the field to help us. This is a crisis that we're in. This is not time for us to have spectators and commentators. What we need is to have all hands on deck. And so I want to send the appeal out to everyone, including all the past CMOs, to come and join us in our all-of-society approach so that we can vaccinate everyone who needs to be vaccinated, whether the population is 40,000 or 100,000. We'll be coming after everyone so that we are all protected.
Dr. Wilkinson, you moved away too quickly. This second question is also for you. Have you shifted your position on mandatory vaccination? Months ago, you said on the Leadership Matters program that there was good reason to mandate the vaccine from a public health perspective. I haven't heard you mention mandating vaccines of late.
I think I said that a few months ago, and the position still stands in that there is good reason to mandate it from a public health perspective. Because there's good reason, it doesn't necessarily mean that we need to move forward with that. Because the reasons why I gave from a public health perspective, number one, if the virus offers significant threat to the public's health, which it does. Two, if we have a vaccine that is safe and effective to address the threat, which we do. Three, if mandating the vaccine versus voluntarily asking persons to come forward and get vaccinated provides better benefit. And four, if the level of coercion or force is proportionate. In other words, you don't want to mandate a vaccine, and if persons don't come forward, you go and lock them up. Also, when I said that there was reason for us to do it, or there was good reason, not that we should do it, back then we had about 10,000 doses that were delivered. You heard that with our messaging, with our education program, we are getting persons to come forward. And so we have achieved what other countries were trying to do with a mandate by appealing to our persons out there. That doesn't mean that as we move forward, if there are certain sectors in society where persons refuse to come forward, especially essential workers, that I may not support a mandate to make sure that we keep persons protected. But in terms of the government making a widespread mandate saying every citizen has to come forward tomorrow to be vaccinated, I am not for that.
Thank you, Acting CMO, for making your position very clear. This question comes from SKN Newsline. There are some people who are hesitant to take the COVID-19 vaccine still because they want an assurance that if they experience some adverse reaction from the vaccine, they would be compensated in some form, especially as it relates to medical expenses. Did St. Kitts and Nevis have the option to sign on to the COVAX indemnity plan when accepting COVID vaccines, and if not, why? Would this not encourage some who were hesitant to come on board and be vaccinated?
I will leave part of that question for the Attorney General's office when he's here, because they were the ones who were dealing with that aspect. But I will tell you, though, that we have told you that the vaccine offers you the best protection against severe disease, hospitalization, and death. And so you can choose, and we say persons have a choice as to whether or not you will come forward and take that protection, or whether you run the risk of losing your life. And that's the choice that persons have to make. And we have been pleading with persons for months now. And at the end of the day, you have to make that personal decision.
Thank you. This question is from Freedom FM. Is it possible for the task force to clarify the protocols that are in place for locally based airline pilots? Are airline pilots based on Nevis required to quarantine? Mr. Samuel?
So Williams, thank you for the question. And yes, local pilots, anyone that enters the Federation are subjected to the health and travel protocols. We have had ongoing discussions with those pilots, and in their best interest and in the interest of everyone, we have stated clearly that it's important everyone follows the protocols. For example, traveling overseas, engaging with other persons, then before we started the vaccination process and coming and basically just roaming around freely with everyone was a significant risk. now that we have reached the state of vaccination, the topic has come up again, and we will be sitting with these pilots and basically working out some protocols so that under the new scheme of the 24 hours quarantine that we have right now, I think that we should be able to reach to some kind of agreement with these pilots.
Mr. Samuel, thank you very much. And that brings us to the end of our question and answer segment. I want to thank both you and Dr. Wilkinson for answering those questions that came in today. I want to thank Superintendent Henry for his presentation today. Dr. Cameron Wilkinson, our acting Chief Medical Officer, and he still remains the Medical Chief of Staff at the Joseph St. Francis General Hospital, which is his substantive post. Surgeon, the surgeon, and he has done a lot of surgeries here too. We thank Mr. Abdia Samuel for his presentation, and we thank Mrs. Christmas Jacobs for her service of sign language. We welcome back AJ, who had a very good vacation. I wouldn't tell you where he went, but we thank him very much, and we thank ZIZ for their continued service here at the NEOC in bringing these briefings live via television, radio, and social media. We thank you. And for all the media houses who continue to play an important role in the dissemination of information that is so important to the management of the COVID-19 pandemic. You know, one of the things that has been a pandemic in itself is the misinformation and the disinformation. That too has been a pandemic, but I think what we are seeing, the data presented here in the Federation of St. Kitts and Nevis, and more people coming and getting vaccinated, it shows that the message is getting through, and that more and more people are developing the trust and the confidence in vaccination and debunking a lot of the false and fake news that is out there. So that is a very good thing. We thank all of you for joining us today for our press briefing. We will be back next week, Wednesday, with another briefing. Thank you very much for being with us, and continue to adhere to the protocols, and we know what those are. Even a 3-year-old can tell you what those protocols are. That is how effective the messaging actually has been. Thank you, and have a good evening.